Mirwat Sami, Mirwat, last name is Sami. I'm an oculoplastic surgeon and an ophthalmologist. So I perform plastic surgery on the face, the eyes, and I'm also an ophthalmologist, a board certified ophthalmologist. And so my main focus is and expertise is in this area. And everything we do, of course, as an oculoplastic surgeon, goal is always to protect and enhance vision.
Right. So let's just jump right into it. Can you tell us about Ozempic, first and foremost? Like, what is it and why is it so popular for the past few years, especially in weight loss specifically?
Ozempic and Wegovy, Mounjaro, these are semaglutides or GLP-1 agonists. And what those are hormones that are produced in the intestinal tract, and they help with slowing down gastric emptying and even slowing down the absorption of glucose. And the way the semaglutides like Ozempic work is that they actually reduce the absorption of glucose in a similar manner and also slow down gastric emptying. So when the gastric emptying and digestion is slowed down, people feel satiated and fuller for longer, and then their glucose levels, their blood sugar levels don't go up as high. So it has been revolutionary in the treatment of diabetes. And we have seen that in diabetics, these medications, not only do they lower the blood sugar levels, but they also lower their hemoglobin A1C. And in that way, their overall cardiovascular risk factors like atherosclerosis, heart disease, stroke. So these have been just amazing for the treatment of diabetes. And one of the effects that was noted was weight loss. And with some of them, like Mounjaro, the weight loss is about 21% and higher, which is very similar to what people would achieve if they were to undergo a bariatric surgery or a gastric bypass. That's pretty significant. And then we have Wegovy, which is another one of that same family of medications. And that is actually approved for weight loss management in adults. And not only adults, it's also approved for weight loss management in adolescents. So anyone 12 and over that is has a high BMI. And then, of course, we have Ozempic, which helps as well. It's approved for diabetes management, and it also has a weight loss effect. So that's why these have been so popular. Since they're FDA approved, the medications are in place, and we're seeing these remarkable results for diabetics.
Okay. So what are the side effects of taking Ozempic?
So because of the mechanism of action of these medications, one of the biggest side effects that has been reported is the gastrointestinal effect and the slowing down. So some people have developed what's called an ileus, when the gastric emptying is slowed down to such a degree that it causes almost like a paralysis of the intestinal tract movement. And when that happens, there's going to be a lot of nausea, bloating, vomiting. But if it gets severe enough, then it can actually cause a functional intestinal blockage. And that has also been reported. There have been a few deaths that have been reported as well from that intestinal ileus.
Oh, wow. So I'm seeing a lot about Ozempic face. Can you explain what that is and if you see that a lot in people who are taking Ozempic?
Yeah, so when Ozempic and this family of medications came out, and then celebrities tapped into it and started taking the medications, and we have all these like the social media, posts with this dramatic weight loss, these real amazing success stories. And one thing that we didn't really they didn't expect to happen, but is not surprising, is Ozempic face. That's a term that was coined to describe this dramatic loss of facial volume that we saw in people taking Ozempic. Now, the reason why that's not surprising is because we see this in other weight loss management as well. Whenever you have a huge amount of weight loss in a very short period of time. You've got to imagine you're losing volume, you're losing fat, you're losing even protein and muscle mass from all over. And so people were beginning to look very skeletonized and gaunt, because it's just like with weight gain. Our bodies can't, like, we can't decide we can't control where we're gonna lose it. You could lose it from one part of your body or another. The face, it's not something that we can really control. And so losing volume in the face, however, was not an outcome that a lot of people were expecting. And we see this with bariatric surgery as well, severe malnutrition, or if people are on these really strict diets where they lose a lot of weight over a very short period of time. So it's all about massive weight loss in a very narrow period of time. And so you're losing all of that volume. And, when it comes to the face, volume is youthful. Everything we do in facial plastic surgery, in cosmetic medicine, and the cosmetic industry is about preserving volume, restoring volume, replenishing volume. And so to lose that was very shocking for a lot of people, and they were trying to understand what's going on. And it wasn't until, there was more, like, this was explained by physicians and surgeons to them, that they understood it was a consequence of that dramatic weight loss.
Okay. Being a plastic surgeon, are you seeing an increase in patients who are coming to you with this problem?
Absolutely. Because when people lose volume in their faces, we're talking about volume loss in the temples, the nasolabial folds, their necks, the chin starts, they start getting a jowling effect. All that tissue in the face, when it deflates, there's all this sort of like a gaunt look. I see a lot of people come in with really significant under eye bags. Not that they didn't have sort of that anatomical or physiologic kind of finding prior to the Ozempic, but then it was just so much worse. All skin started hanging. So their eyelids got droopy, the bags became more prominent, the cheeks started descending and deflating, the jowls started developing, the temples started looking very gaunt and making people look very skeletonized and hollow. So all of us across the board seen a huge uptick in people seeking cosmetic treatments. So there's a big crossover between patients taking Ozempic and the semaglutides coming into getting more plastic surgery. Because remember, the people that were taking this that are non-diabetics and are doing and maybe not even obese enough to use this on label, but they're doing it in off-label weight loss management. For those people, they were doing it to look good. And now their faces are making them look aged rather than younger. And so we saw a huge crossover of patients now panicking and trying to get something done to make their faces at least start looking a little bit fresher, a little bit revolumized.
So that's going into my second question. I'm seeing on social media a lot of younger people are starting to take Ozempic. What advice would you give to them? Would you tell them like, oh, to take Ozempic, or is there something else that they could perhaps try to do? What if they say like, oh, I've tried this, I've tried to exercise, I've tried to eat healthy, and nothing is working, and this is the only thing that will possibly work for me? What would be your advice for someone who's younger, who's never had kids? Can you just give some advice to someone that's trying to take?
Because you know what? We've all been in that position. Okay, we've all been in that position where we're struggling with our busy lives and then looking good and weight management. So it's so important for people to understand that these medications, they do work. However, number one, we went through this huge shortage of these medications for diabetics who really needed this. And some of that is because of all of this off-label use. And the second thing is we also saw a lot of unregulated use of this medication. So everywhere you look, there's another little clinic that's popped up and they're using a version of a semaglutide, and it is not a regulated version. It's not a pharmacy that has, a pharmaceutical product that has, say, been FDA approved. And it's from the same family of medication, but it's less regulated. So there are some risks with that, because then you can always be getting a higher dose or not high enough dose. So, it's very important to do this the right way. The second thing is this struggle of weight loss management is it's tied into a lot more than just busy lifestyles and inability to work out, and it's about really improving our lifestyle, because we want to look as young on the outside as we feel on the inside, but that doesn't come without a really good change in our overall lifestyle. So healthy eating habits, staying hydrated, maybe consulting with the nutritionist. And especially for people that want to take these medications, they need to be so aware of these side effects. I am not very much in favor of these medications because of that dramatic weight loss that we cannot control where you're going to lose it from. And then you cannot get it really back, especially in the face. So I know at this end, as a surgeon who's having to fix these problems, that it's very hard to revolumize the face. And most of the time, people end up having to have surgical treatments. There's just that much filler we can put into the face safely and effectively without it looking overfilled and done. And then, we're talking about surgeries that people have to now undergo at a slightly younger age if they want to achieve that look. And it's not a very easy decision for a lot of people to make. And so, I do think that there should be a lot of thought put into this journey of weight loss management. And even if someone does start taking any of these semaglutides like Ozempic, they should still consult with a dietitian and a nutritionist to make sure they optimize their intakes, their dietary intakes, because we can lose a lot of protein, a lot of muscle mass, and we're doing all of this to look better. And then imagine if your body is looking great, your face is beginning to look gaunt, or you're losing a lot of muscle mass as well. You're looking a little flabby everywhere. And so that's something that people should try to understand can happen. And if they can consult with a nutritionist prior to, they will definitely be able to optimize their diet so that they don't lose a lot of protein and muscle mass from their body. As far as the face is concerned, what we lose in our faces, we cannot really get back. Because when that volume is lost, when there's a little bit of fat loss globally across the face, even all the ligaments that keep our face looking tight and elevated and contoured, everything kind of sags. So, it's so important for people to understand that this is happening. And that's why, your segments like yours really help highlight that before, so that people can make a truly informed decision about their lives and how do they want to embark on this journey.
Right. And what if someone they're on Ozempic and they have this great weight loss, but they cannot afford cosmetic surgery? Is there anything else that they can do um to kind of mirror the same effect or get rid of some of the Ozempic face, as everyone's saying?
Not really, because there's even with something like dermal filler injections, we're talking about thousands of dollars. And there's only that much filler that can be injected safely and effectively without people looking almost, like an avatar of their original faces. So it's very hard to get that volume back. And there's no exercises you can do. It's trying to like maybe have a healthier approach to food as well that they need to engage in. But if you're asking, are there any like exercise? Is that what you're asking me?
Mm-hmm. Like any like
Yeah.
exercises or anything, like if cosmetic surgery is just not on not affordable for you, is there anything that you could do? Because it's regular everyday people that's taking this for weight loss. So I
Exactly.
think it's something that they need to know, that if you can't afford thousands for cosmetic surgery, then you're going to be stuck with this, especially if you're younger. You're going to put on at least 10 to 20 years. And I think that's important to note, that you may have this weight loss, but then you're going to have this other issue that you have to do.
Absolutely. And in the field of medicine, what you're saying is literally the exact meaning of informed consent. When we say informed consent, the patient consented to a treatment, whether it be medical or surgical. That is exactly what it means. Knowing all the benefits, the potential benefits, and all the potential risks. And it does include what's going to happen to your face, what's going to happen to your body. And a couple of things that we didn't talk about, which I wanted to mention, as an ophthalmologist, I feel like I have to the center of my universe. So I want to talk just a smidge about, like, a little bit about the diabetic retinopathy as well.
Yes.
Can I go ahead with that?
Yes, of course. Yes, please.
So in the field of ophthalmology, we've also found that people that are taking the semaglutides, Ozempic, Mounjaro, etc., they have had now these are diabetics that might have underlying diabetic retinopathy. Diabetic retinopathy is the effect of diabetes on the eye and in the retina. And it can cause vision loss. It can cause numerous conditions, including elevation of pressure in the eye. Some of these changes can be irreversible. And the best way to know if someone has diabetic retinopathy is when people are diagnosed with diabetes, we recommend that they get regular annual eye exams, and sometimes even more frequently than once a year. It can be every 3 to 6 months for their retinas to be examined and a comprehensive eye exam. And what happened in diabetics that were taking Ozempic and Mounjaro and Wegovy was that they saw this dramatic drop in their hemoglobin A1C, huge success stories. But when they were seeing their ophthalmologist, noted that they had a rapid progression and worsening of the retinopathy. Typically, we want to see that retinopathy either stabilize or not advance any further. But here, what was happening is the complete opposite. And so that set off a lot of alarms in the ophthalmology world. Now, the jury is out, I have to say. We're watching this very closely because obviously we all feel that, of course, your vision is very critical. It's the center of our universe for our patients and for what we do for them. But because of the vast improvement in their overall hemoglobin A1C, their quality of life, their reduced cardiovascular risk factors, it's very hard to say, oh, don't take these medications, because the rest of their body is actually doing much better. So that's why we're trying to be a little thoughtful about our recommendations. What do we do with this data? Mm-hmm. Now, having said that, we see something similar happen in people that undergo bariatric surgery. So again, it comes back to that, rapid weight loss, rapid glucose and glycemic control. And so we saw this happen in patients that are undergoing bariatric surgery, transplants, anytime they, like really fast glycemic control, diabetic control. So we feel like now we have enough data, and we have a lot of studies that are ongoing, by the way, on this, so that we can come up with the right guidelines and recommendations for our patients. So we still have a few studies that are in the process of being wrapped up, but what we are finding is that this progression of the diabetic retinopathy kind of stabilizes over the course of 12 to 18 months. And so essentially, I feel like what it's going to come down to is that we're going to change sort of our management goals and not necessarily change the use of these medications. So we're not going to recommend that you stop these medications, but we'll probably add in some other elements of surveillance for our patients. So for example, before, most diabetic, like everyone who has diabetes should be getting their eye exams to rule out diabetic retinopathy. That is standard practice across the board. And that is an important thing for everybody to know, that if you're diabetic, that should be something that your doctor is recommending that you go see an ophthalmologist, number one. Number two, when it comes to being on these medications, it's probably going to be recommended by us ophthalmologists that people have at least one sort of baseline evaluation before starting the semaglutides, so that we can establish what level of retinopathy they have, if at all. And then depending on where they are, how much retinopathy they already have at baseline, will determine if we're going to see them in 3 months, 6 months, or continue once a year. And just kind of make sure that we don't let any significant changes go unchecked that could be treated with lasers or any other surgeries to control their vision loss aspect of the retinopathy. So that's pretty much how we feel this is going to impact people that are on the semaglutides, is that we're probably going to change some of the surveillance mechanisms we have, the recommendations for our patients that are on semaglutides, but not necessarily have them stop, because they have such a benefit on their glycemic control and their overall cardiovascular health.
Right. So for people who are using Ozempic for weight loss, how long are they usually on Ozempic, and what happens when they start to get off? Do they gain the weight back, or can you just explain that process?
Absolutely. So with Ozempic, what ends up happening is that there's a little bit of that slowing of the gastric emptying, reduced glucose absorption. And when they stop taking it, obviously that effect will go away. In some people, that can be sort of a little bit of a residual effect for a few weeks, but eventually that does stop. And typically it's anywhere from like 5 to 6 weeks that effect kind of reverses, and they go back to their regular baseline. And yes, they do start gaining weight. I have patients that come in to have surgery, and we have to have them stop the semaglutides prior to surgery, which is something that we talk about. So I have patients that come in to have surgery. When we have the semaglutides, they talk about how they start gaining weight, and so definitely they just go back to gaining that weight. And most people will be on Ozempic for somewhere like around a year. It's all about meeting your goals. The right way to do this, if we're doing it for weight loss management, is that patients, with the help of their physicians and hopefully a dietitian or a nutritionist, come up with a weight loss goal. Everything should be goal oriented in this or in any medical management. What is your goal weight? How much weight with your body type and your height should you be losing? When you hit that goal, you want to start tapering off these medications, because what it does to your gut, slowing it down. There have been reports of, even after stopping the Ozempic, people still having that slow gut movement, and not necessarily an obstruction, but almost like a paralytic ileus. So you don't want to be on a medication that's, number one, it's also expensive, and it's so much in demand for people that really need it, like diabetics. So rather than depleting the resources, people do need to get off of it when they hit that goal. But what ends up happening is that they start gaining weight. So that's why having that lifestyle change is so important, because you want to maintain what you've achieved. So not visiting with a dietitian and nutritionist, maybe even, a psychologist, because a lot of eating disorders have a psychosomatic element. And people do need help in their relationship between food and their body and their sort of stress management. And so it's very important to kind of think about this in a more holistic manner. It's not just your body, it's your mind. Everything needs to be sort of reoriented for this journey. And eventually they have to get off of the semaglutides. And that's when I think people struggle a little bit with the weight gain.
Is there anything else you would like to add that we missed or that you want anyone else to know about Ozempic?
Just two things. One of them about surgery, and then the other was that there is like, I know that everyone talks about the thyroid cancer. Do you want me to say anything about that? There's
Yeah, of course.
not very like a causal relationship hasn't been found, but it has. Like it's been reported. So I'll talk about that first. There is literature that reports an increase in thyroid cancer with semaglutide. So anybody that has any type of thyroid cancer, papillary, follicular, medullary, it doesn't matter, they should be avoiding semaglutides. Now, the data is insufficient at this time to really report a more sort of statistically significant causal relationship, like, you know, between the two, between thyroid cancer and the semaglutides, but been enough reported cases that we're on alert. So that is something that people should know about if they have a family history of thyroid cancer. This is probably, not, or a personal history. This is probably not the medication that you should be on. Then let's talk about surgery because that's an important one. So what happens, that one of the effects, let me put it this way. Now we talked about how people, when they develop Ozempic face or even all that weight loss with flabby skin in their body, seeking plastic surgery. Now, plastic surgery is done under anesthesia. And so what we found was people that are continuing to take these medications would come in for surgery and have their stomachs full of food. And the problem with that is when someone is given anesthesia, it kind of like paralyzes your entire system and relaxes it enough to where you can reflux all that food from your stomach and it can be aspirated into your lungs. And so the risk of aspiration pneumonia is high. And that's why we have our patients avoid anything to eat or drink before surgery for a certain number of hours, depending on if they're going to be under just mild sedation versus general anesthesia. And we really have to follow those guidelines for their safety, because remember, these are elective procedures that we choose to do, whether they're cosmetic, more for your functionality. But these are elective. So we want to make sure that people are optimized for the surgery as well. And what we discovered, our anesthesiologist discovered that people had stomachs full of food that they could reflux and develop aspiration pneumonia. And aspiration pneumonia is a kind of pneumonia because the bacteria from your intestinal tract is different from the bacteria that causes pneumonia and is much harder to treat. And that's why it was a huge risk. And because of these findings, we have had to change the guidelines for surgery, where before people were asked to avoid eating or drinking, for 8 to 10 hours. Now it's a little bit longer. And then also to stop the Ozempic at least a week prior to the surgery. And the issue that we encountered is that because a lot of people are doing this off-label, getting these weight loss treatments at these loss clinics, and something that's maybe a synthetic semaglutide and not a brand like Ozempic, they wouldn't report it to us surgeons, and the anesthesiologists wouldn't know. And so people were not even putting it on their list of medications. I think some was they were just not comfortable discussing it. Weight loss, that journey is so personal. So we wouldn't find out about people taking these medications. And during surgery, there were reports of aspiration. And, further and discovered that people were actually on these semaglutide. So we really encourage folks, whenever you have medical or surgical treatment, it's so important to be, to share all your past medical history, that's whether you consider it relevant or not, share it with your surgeon, share it with physicians, that we can make the decision for you. And people were withholding that information. So it's so important for everybody to know, this is a medication you should report, especially if you're gonna
No, really, that's it. I mean, they have.
Okay.